Hi, everybody. Thank you for joining us. We're going to be talking today about phobias in children, and we're going to get some amazing advice and tips from a clinical psychologist, Dr. Natalie Flatter, who has joined me here today. Thank you so much for giving up your time, Natalie.
That's a pleasure.
Welcome. Really, really pleased to be talking with you. It's a really interesting area, and it's something that I myself have not had a huge amount of experience with. So I'm really looking forward to hearing your advice and your tips and understanding a bit more about what phobias are and things like that. But before we get started, you're a clinical psychologist, but I imagine there's people watching thinking, what is a clinical psychologist? Because there are psychologists and psychiatrists and therapists. So maybe it'd be great if you could just tell us a little bit about what a clinical psychologist does and if there's any particular areas of specialism that you have.
So a clinical psychologist is trained to assess and treat a range of mental health problems in people of all ages and backgrounds. My area of specialty is children, young people and families, but people can specialise in all sorts of areas like OCD or eating issues.
Okay, amazing. So you've had experience working with children with phobias before. So you're nodding. You had quite
it's
a
common.
lot.
It's very common.
Really common. I think that's really interesting you say that it's common because I think it's common in the sense that everybody knows about phobias, but I don't know that necessarily everybody has had experience themselves or with children, whether it's their own children or children that they work with. But maybe a really good place to start would be if you could just explain to us what are phobias, because we may have experienced what we have a sense of the behaviours that children present with. But what are phobias?
So we all, as people, have fears of things that feel threatening to us. And phobias are those fears that become really, really significant and really, really affect us. So, for example, I might be afraid of wasps, but if I have a phobia, maybe I'm driving around in the summer with my windows up in a stifling car with no air conditioning, and the phobia means that I can't open the windows even though I'm really, really hot. So phobia is a more extreme version of a fear that starts to really dominate your actions. And it's interesting what you say about parents, because I think as parents, we don't want our children to be upset at all or in any kind of distress. So when you're a parent and you see your child have a phobia and get really, really anxious, we want to solve it. And as parents, sometimes that could be unhelpful if we start to help our children avoid distress and avoid the thing we're afraid of. So a good example of that might be lots of kids being afraid of dogs, and the child doesn't want to go to the park because maybe they're afraid of dogs, but actually there's loads of dogs at the park, and then the parent doesn't take their child to the park, and then the child gets to miss out on going to the park. So it can be a really tricky issue for parents.
Okay. So it's that sense of things really affecting the day-to-day lives, affecting you living your life to the full. So for children, it's how it impacts on them in terms of them being able to do the things that they would normally want to do.
Yes, a lot.
Okay. Are there some children that are more likely to have phobias than others?
Well, in my 20-year career, I've seen loads of children with all different phobias. So some will be the common ones like dogs or the dark, and some will be more specific like bananas or buttons.
Okay.
So I think that if a parent has a particular phobia, I'll often see the child with the same or very similar phobia. Maybe it's learnt, maybe it's genetic, but also children with developmental issues like autism are more likely to have anxiety in general and develop particular phobias.
So maybe more prone and more sensitive to having those extreme responses. Okay. Yeah, I can see that pattern through generations. I can think of my own family. Yeah. Sorry if you're watching family, but I'm going to say the word spiders. Yeah, I can see it coming down the generations in that sense. So yes. Okay. Now that's really useful. It's good to sort of get that sense of what it is, and it kind of helps us sort of make it seem a little bit less scary, really, that it's a natural part of our development. Fears are normal. Fears are a little bit of fear is okay, right? It's
so it's interesting because a lot of things we're phobic of really might be a threat. So, for example, the wasp could really sting, and actually, if you were allergic to that would be a real threat. But things like spiders, for example, are not a threat, really, especially in this country. But things like dogs are quite interesting because they could be a threat. Yes. But domestic dogs, not very likely to be. So our brains weigh up what seems to be the threat. And sometimes there might be a genuine threat, or we've had a bad experience, like being bitten by a dog. Yeah. And other times nothing bad has happened, but our brain tells us this thing is frightening and we escalate that.
Okay. And how can parents tell if it's a genuine fear? You know, we've both got children, so we've both experienced with should we say, pushing the boundaries. But so how can you tell if a child is genuinely sort of afraid of something, or they're maybe just trying to sort of avoid doing something they don't want to do?
Well, if I am assessing for that professionally, I'll be looking for whether the child might get any secondary gain from the phobia. So whether there's any sort of payoff from it. So for example, I'm afraid of the dark, so I'm going to not go to bed and I'm going to stay downstairs and watch TV with you, Mum. Well, there's a payoff from that fear. I'm also looking at how distressed the child is. And I think you can tell when there's a real genuine level of distress. And also looking at how much it impacts their lives. So, the kid that misses the birthday party because they're afraid of balloons, the kids that actually they really start to miss out because of it, then you can tell it's really genuine. When the child really wants to be doing something and they can't.
Slightly different presenting behaviours, okay. What would you say the most common phobias are? I know you said that it can be anything and everything, but are there some that are sort of known to be sort of much more common than others?
I think so. I think the dark is a really common one. Adults feel threatened in the dark. So that's a common one in younger children. But what I'm seeing at the moment a lot is fear of vomiting. It's called emetophobia. Wow. Lots of children and adults, but particularly children. And also I'd say being scared socially, like in social situations, kids are, but becoming phobic even to the point where they're avoiding that and getting quite distressed.
Okay.
But probably the dark and at the moment vomiting, the common one.
And with the vomiting, is that they're afraid themselves of being sick or they're afraid if somebody else is sick?
Both. It's both.
Do you think there's any links with the pandemic?
That's a very interesting question. However, I would say that I was seeing high levels of emetophobia before the pandemic, but it probably hasn't helped.
Okay. So as a psychologist, if somebody was to come to you and say, my child is afraid of the dark, or they're afraid of bananas, whatever it is, what is it that you can do as a psychologist to help?
So again, if I'm assessing, I'm looking for how, as you said earlier, the behaviour gets affected. So what behaviours of the child showing that we want to shift around. But also, and this is really important for me as a psychologist, what are the thoughts that the person's having? So, for example, let's say it's the dark and a child thinks there's a monster under my bed, or a burglar's coming in, or if it's a dog and they think the dog's going to bite me. We have to get to what the thoughts are. And then as a psychologist, I try to work to help people learn through experience that usually those thoughts, because occasionally those thoughts could be correct, but usually they're exaggerated thoughts or catastrophized thoughts, and we try to shift those. And then in shifting the thoughts, we hopefully shift the behavior, because once the child realizes, oh, the dog isn't going to bite me, they then don't have to run screaming away from it.
Okay. And so do children come and see you and sort of spend time with you? Is there a sort of a set time frame that typically works, or is it
if a child is really motivated themselves to overcome the fear because it's getting in their way, then usually treating phobias is often quite straightforward and probably would be 6 appointments maybe, especially if they've got really supportive parents. The problem is often with phobias, the children aren't that motivated to tackle them because they'd rather just pretend it didn't exist, and sometimes the parent would too, and so therefore it's a bit longer.
So now's probably a good point just to pause. It'd be really interesting to hear a bit about your work. I know that you previously worked at the NHS. I don't know if you still do, and I know you do independent practice. But if anyone's watching and is interested and is concerned and would want to get in touch with you, just be good to just hear about your practice.
Yeah. So I was 16 years for the NHS in a severe mental health service, but often with phobias you might get seen by a service called Step 2, which is the more straightforward for phobias, more straightforward NHS service. Unfortunately, waiting lists are long, so private practitioners like me usually have a shorter waiting list. And I think if you're really worried about your child and it is getting in the way of their life, either consult your GP or you can look up an independent psychologist who will work privately and hopefully effectively and quickly treat your child.
And I know sometimes people have an image of a psychologist, and that means you're going to go and sit on the sofa, lie on the sofa, and you're going to be able to read their child's mind, or you're just going to prescribe loads of medication, which, you know, medication can be really helpful for some children prescribed by the right practitioners, but that's a bit different from what you do, isn't it? Yeah.
Medication for phobias we certainly wouldn't try until you've tried talking therapy first.
Okay.
So if you've tried talking therapy and it hasn't worked, you might get to medication. But in the first instance, it isn't lying on a couch, it's sitting on a chair and having a chat. And some children are very talkative and some take a little bit longer to feel comfortable, and that's part of our job, to help the children feel relaxed and comfortable to talk. And if they still can't do that after a while, we might use play or games or drawing and those kinds of things.
Okay, it's all part of your training, isn't it, to help a child engage? I know when I work with children, a common question that I get from parents is, they're really, really nervous, and what if they don't engage? What if they, get really upset? And I sort of reassure them that it's part of a psychologist training, isn't it? It's part of what we do, is to be able to help a child feel relaxed. And
most people are nervous. It's like going to the dentist, isn't it? You don't know what to expect. It might be painful. They're going to be nice to you. And yes, part of our job is to help people feel at ease as quickly as we can.
Yeah. Wonderful. Okay, this is really, really brilliant, Natalie. I'm learning so much. The next question I wanted to ask was, if you could give some tips for parents. I know that obviously every child is individual, and it's limited, without knowing the child specifically. But if there were, some sort of do this or don't do this, just some useful tips, useful rules of thumb that parents could take away.
Yeah. I would say that a lot of the time parents sadly get caught in a trap of helping the child avoid whatever's making them anxious, because as I said earlier, the parent doesn't want their child to be distressed, so they'll often help the child avoid things. That doesn't really help in the long run, because in the end the child never learns to face the fear and manage it. So a good starting point for parents is to role model managing the situation themselves. So it might be that your child can watch through a window or something, you stroke the dog, or you be in a room with a spider or something. So role modeling that something isn't scary is usually a good place to start, rather than avoiding something with your child. And then if you can get to the point of trying to help the child take small steps themselves. So it might be going to the park, sitting in the car park in your car and watching other children play with a dog, for example, would be little steps, and never ever force your child into a situation that terrifies them, because you're not going to help that way either. So I think it's being patient and encouraging and taking small steps to help the child learn, which is fine if the parent isn't scared themselves.
Just going to say, what if the parent has their own?
Then the tip is get help yourself, because that will help you help your child.
Okay, and lots of deep breathing and self-awareness and thinking about, are you projecting calm, or you're projecting your own nerves, your own fears and anxieties, then that will heighten for the child. Okay, that's brilliant, really great tips, thank you. So just to finish off, I ran a short poll on my Facebook group. And if anyone's watching, the group is Top Tips for Learning and Child Development. You're welcome to join. It's a free group. We have loads of useful information, advice, and some fantastic talks from a range of professionals every month. But I ran a poll and I asked what the most common phobias were in the members of the group and their children. And the top ones, you've mentioned them all actually. It was the dark, dogs, spiders, and sick, which actually that did surprise me, obviously. Not you, because you said you've seen quite an increase in that. So in terms of these particular phobias, is there anything unique to each of them that would be worth parents understanding? Any particular approach is unique, or is it still very much the same for all different phobias? It's just about desensitizing.
Yeah, I think it's very similar, but it would be really helpful for the parents or whoever's working with the child, to understand what specifically is worrying the child about each thing. So for sometimes it might not be, let's say the dog's going to bite, it might be I'll catch fleas. So you couldn't handle the worry about the dog biting if the child is worried I'll get fleas, for example. Or the dog will make a mess, or something like that. So I think it's about understanding which particular element of the phobia is worrying the child. So that you can then work or help them, support them with that particular thing, because otherwise you get it quite wrong potentially.
And that can be quite hard, can't it? As a parent to sort of, it's very difficult for a child to, if they're asked, well, why and what, and direct questions, for them to sort of actually be able to make sense of themselves. And
it's true, that's really difficult. And a question that I like to ask is, what's going through your mind when you see a dog or when it's dark? What's going through your mind, or what ideas are in your head? And so with the dark, children might say monsters or something like that. So sometimes if you can be specific with what's going through your mind, then they can say, but it is tricky sometimes to get to that.
And would you say it's better to have these sorts of conversations away from when we're in the moment of being afraid, as opposed to, they've just seen a spider, they're in absolute panic mode. But what is it about the spider you don't like? Yeah.
Definitely it's a calm time when you're calm and your child is calm, maybe after the event, sometime after when everybody's calm, to say, and when you saw it, what went through your mind, definitely.
Yeah, amazing. Okay. And so through these techniques that you use as a psychologist to desensitize children, the idea is that they then learn that it's not as such a scary thing. Is phobia something that can be cured? Is it something that is for life? Where's the research on that? Where else that?
So the way I would present that is that the phobia can be turned into fear instead of a phobia. So you might never like that thing like spiders. You might never end up holding one or having a pet spider or even a pet dog. But if we can help people manage it so that they can face it, so that if you were invited to someone's house and they had a spider or a dog, you could go. So we want to turn the phobia into maybe just a worry or a fear or something manageable. Sometimes they can be cured completely, but more often you're just looking to make it manageable.
So that they can live their lives, kids can go to the parties, they can go out there. There's one other question that I wanted to ask that I've just come to mind, which is a lot of the children I work with are neurodiverse. I'm thinking particularly of children with autism or that have ADHD, and a lot of those children have accompanying sensory integration needs. So they're over or undersensitive. Do you see any links between sort of those sensory side of things and phobias, or is it very much just anxiety? I just don't know if there's anything in particular for neurodiverse children that sort of it means that the phobia is slightly different.
I wouldn't necessarily say that the phobias are different themselves, but they're more likely to occur, sadly.
Okay.
And I think that the treatment often takes longer because the thought patterns are often harder to shift. So, for example, with a child with ADHD, you might have to have shorter sessions, or they might have trouble focusing, or you might need more breaks. And a child with autism, for example, the thought processes that I was talking about are a lot more rigid and fixed, so they're a lot harder to shift. So I think that although the presentation might be very similar, your treatment plan probably takes a little longer and needs a lot more patience and encouragement and adult support.
And a lot of these children will struggle with regulating their emotions and will sort of go from 0 to 10 and they'll have a lot of meltdowns. Are phobias known to trigger emotional meltdowns?
Yes, definitely. Any anxiety or phobia could, and then often that will be helping the parent respond as well and giving the parent tools and techniques. I think it's a breathing. So it might be for the parent to stay calm and breathe themselves, but also to help the child calm down and manage, and give the child tools to manage the emotions before you then manage the anxiety itself.
And that's all sorts of things that psychologists can help.
Yeah, lots of them.
Natalie, thank you so much for talking with me today. It's been really helpful. I've learned a lot myself, and I'm sure families watching will have found your advice and your tips really, really useful. It's been a really interesting talk, and really appreciate you giving your time. Thank you so much.
Thank you, Hannah.
Take care, everybody. Bye-bye.